Hey guys, this is Dr. Subhav Ramnani, and currently it is 8:35 a.m. and I'm about to go for my internship, and I've already done some practice questions to get my brain started. I usually do that in the morning, and I also do more studies later. But let me take you through my day, and today we'll have a little chit chat because there's something I want to talk about. So let's go. So, today, while going to the internship, I'd like to talk to you about what to keep in mind at the back of your mind while in internship. Um, so, I have already done 2 months of internship. So, but there was a lot of thinking into why I opted for internship, where I opted for internship. So let me talk more about that. So, for example, for me, I am preparing for my USMLE Step 1 exam. So I did not want that I spend all day in my internship because I really have to study for that exam also, and that requires some time. So I needed an internship which could give me some flexibility at least. So I decided not to opt for central government institutions because, to be honest, from what I've heard from my seniors, you do not really get much time to study. So, for example, if I would have opted for an internship in a central government hospital in Delhi, there I would be working non-stop. For sure, my practical exposure would be much better, but for me, like for my goals right now, I decided that, hey, I want the practical exposure, but I also want some time to study at least. So maybe I cannot give my USMLE very soon, but I can at least prepare for it and give it some time during this 12 months internship. So that's the first thing I wanted to do, to have some flexibility in my internship schedule. So now I have some fixed working hours. Of course, we have night duties, and this, like, there's a whole roster. The schedule keeps changing, but it's still manageable. I would say it's 8 to 9 hours every day, and of course, if there's night duty, again, it depends on day to day. But I can definitely say that I can get time to study. So that was my first thinking behind choosing the internship where I chose it. Another thing is, if let's say you are preparing for entrance exams, right, or you're not preparing for entrance exams. I know, and I already did a podcast with MedKit Diaries. You can check it out on my channel. So she did her internship without thinking about anything else. Like, she was not preparing for NEET PG or USMLE or PLAB or any entrance exams. She just wanted to focus on her internship fully, like 100% commitment. That was her goal. She wanted to excel in the practical part, the clinical part, and she chose, like, I'll do my internship and I'll do it so well that like my 100% commitment will be towards internship, that I don't have to think that, let's say, I want to go back home and study. So there's this mental added pressure. So that's why she must have chosen the internship she chose, or she's an Indian medical graduate. She did it in her college. but that is another way of thinking about internship. So what are your goals? Ask yourself, after FMG or your, I don't know, final year of exams, why are you going into internship, like with something at the back of your mind? Are you going to prepare for your entrance exams, NEET PG? If it's NEET PG, then go to an, and if you have the power to choose where you do internship, then go to an institute where you can get some time to study. Or if you lack practical exposure and you think that your clinical skills are absolutely zero, then go to an internship which will have like a lot of clinical exposure. Like go to a central government hospital, you will have a lot of like the maximum clinical exposure. If you think your analytical skills are lacking, your clinical skills, like you want to develop but not that much, but your analytical skills are lacking, again, don't go to a central government institute, I would say, because there is so much patient load that sometimes the analytical part is just skipped. You just everything is in such a hurry that there's no time to analyze, maybe the patient, or the senior doctors do that, there is no time to discuss it. So in that case, I would say opt for an hospital where the patient load is not much, like mine. So I have all the time to review the studies, to see all the reports of the patients, to actually discuss it with the doctor who's seeing the patients. And I have a lot of time to discuss these cases and develop my analytical skills, which are actually eventually helping me in my studies as well. And my goal here is to complete my internship, get some practical skills, and also improve my knowledge for these various entrance exams. So that's why the analytical thinking part also matters. Do you in your internship have the time to review the patient's files, everything apart from the normal internship work which you do? And yeah, without much further ado, let me take you through my day, and let's go to the hospital. So I'm done with the surgery OPD, and I'm going to go for rounds with the RMM here for gastro. So I'll be seeing gastro patients, and let's see if I have some procedure to do today, like ascitic tap or something like that. Let's hope. So I'm just outside the hospital building, and I have done, or we're done with surgery OPD and gastro postings. So surgery OPD mainly, there are cases of post-operative cases, for example, for dressing. Today there was dressing for like laparoscopic cholecystectomy was done on the patient, 2-3 patients of that. And there are cases mostly related to rectal bleeding or pain while defecation. So we checked for hemorrhoids, anal tear, abscess, pilonidal sinus, etc. and etc. After that, we also have other cases, and mostly, yeah. And then for gastro postings, I saw the IPD patients, which were there. 2-3 patients were for pancreatitis. We wrote ERCP, MRCP for some, like in total there were 10-15 patients for gastro, which we saw and discussed. And I discussed everything with the medical officer here. So it was a good analytical discussion on the treatment plan and the diagnosis, and definitely learned a lot.
Having fun.
वो जो लेबर रूम
done with the posting. Chalo? So, internship is done and it's time to go home. And I hope you got the idea I was trying to say or trying to explain that why I chose this internship and why internship choosing it should also be a part of your decision process, and you should think wisely before choosing an internship, because this is the time you get to learn a lot of things, and this is also the time you prepare for future exams and stuff and your future jobs and everything. So you have to keep everything in mind that yes, I want to do an internship where I will get all the practical experience I need to do a job further, and I'll also get some time to study where for some entrance exams and everything. So if you get the best of both worlds, amazing. Like, I would say wait for that opportunity and get an internship where you can do both. If only one is your primary goal, for example just practical exposure, then go ahead, take the government institute. And yeah, that's pretty much about it. If you like this, I don't know, this video more than a sit and talk video where I go through my day and also share what is going on in my brain, then yeah, go ahead and hit the like button and let me know that these type of videos are interesting and good, and I'll try to make more of these. Until then, stay safe, stay happy, and stay mad, but just about medicine. Bye bye.